how do we prevent? Let's talk a little bit about prevention. So let's talk about screening. Okay. When should someone screen for breast cancer? When should they go to their doctors and get a screening test for breast cancer? And what is a screening test?
So there's still some debate about this. Some say
Mhm.
from when you're 40, others say from when you're 50.
Mhm.
But people who have looked at the Black community, they say they're trying to advocate from when you're 30 to
Mhm.
start going for your screening tests.
Mhm.
And like I said, there's the general examination, but then they're going to do like a mammogram or an MRI scan just to examine your breast. And it's good to
Mhm.
have this sequence of tests because they can actually
Mhm.
compare what it was this year as opposed to what it was last year, and then they can
Mhm.
see if there's any change. Um, Having said that, too, you also want to be aware that you are exposing yourself to radiation. I mean, we have to
Mhm.
mention that as well. So that's the other side of the coin that one should be aware of. But it is super important. Now there are also other things like uh, fluoroscopy. It's not fluoroscopy now. Fluorescent. Something about the heat signatures. There's some non-invasive heat signatures where they'll test and they just see the degree of heat around in the breast, and they can detect where there's a hot node, so to speak, if there's something going on. That may be safer. But in
Mhm.
general, it's really important. It's really important that you have a high degree of suspicion and check these. Have a doctors check it, especially when you turn 40.